Alrighty, chat. Let's get started. Sorry for the delay today. I'm super excited about what we're going to be doing today. And it just took me a little bit more time to kind of formulate what's going on, how to do it well, etc., etc. So welcome to another Healthy Gamer GG stream. My name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational and entertainment purposes only. So if y'all have a concern or question, please go see a licensed professional. Going to be very true of what we talk about today, because we're going to be talking about a couple of more discrete psychiatric topics. So we're going to be talking a little bit about body image and the evolution of body image and how body image affects different people. We're going to be focusing a little bit more on male body image today. Part of the reason that we're doing that is because I think we've had some assumptions about mental health and mental illness and psychiatric diagnoses. And some of those assumptions are actually quite gender-based. And so I think part of actually what we're seeing right now in society is some of those gender-based assumptions around mental illness actually falling apart. And so I think there's actually a lot of need for education on gender-related mental health issues that are traditionally viewed as like mental health issues of the opposite gender. So just to give you all an example of that is when you think about, or even psychiatrists, for example, when they think about body image, they tend to think about women being diagnosed with particular things like anorexia. And there's even statistical evidence to support that kind of thing. But I think as things are evolving, we're sort of starting to see that some of these core issues can manifest differently depending on your gender, your culture, etc. And so in that same vein, we're going to be talking about body image today with a little bit more focus on men. And we're also working on, for example, like the another gender kind of imbalance sort of thing, which is actually specifically ADHD and autism in women. So when we talk about ADHD and autism, we tend to have our diagnostic criteria, our treatment approaches tend to have a bias that are based more on men, right? So we'll sort of, men are diagnosed more with ADHD, men are diagnosed more with autism. And so as a result, a lot of the way that we sort of handle those diagnoses has an inherent gender shaping to it. And so I think one of the key things that we really need to learn about right now is that for certain diagnoses that are classically viewed as being more specific to a particular gender, how is society and technology evolving to where like this could be manifesting differently? So today we're going to be talking about body image. But I've got a video, hopefully we'll do that in the next couple of weeks, about ADHD in women and some of the specific manifestations that are different. Speaking of ADHD, so this is stuff that is not in the guide. So we have the guide to ADHD and doing stuff is out. So far, we've gotten really good feedback about it. One person in stream on Friday was saying it was transformative, which is fantastic. We're happy. Hopefully the transformation was a good one. This is our guide to being able to do stuff. So not only do we teach about ADHD and kind of like what it is from a clinical perspective, as well as like some basics around, how do clinicians approach treatment. A lot of people are concerned about medication and stuff, but we also talk a lot about doing stuff. So where do thoughts come from? Where do behaviors come from? If there's a goal that you have, what are the different neuroscientific and psychological mechanisms at play that determine whether you accomplish the goal or don't accomplish the goal? And so we break everything down into, core, like where do thoughts and actions and how do thoughts lead to actions, as well as certain neuroscience principles, as well as things like exploring resistance. So how do emotions and ego get in the way of us doing things? So if y'all are interested in that, definitely check it out. Just a quick reminder that we're still doing our first session on us for coaching. So we really appreciate everyone who's supported us. I see there's a hype train running right now. So everyone who's subbed, supported the stream, donated, etc. We really do appreciate all the help. And because of help like what y'all are providing to us, we can actually offer a first session on us for coaching. So if y'all are interested in trying out coaching, give it a shot. First session's on us right now. And yeah. So we're going to be at TwitchCon on Friday, so Friday or over the weekend. So that's pretty exciting. So we won't be streaming on Friday, but we will be at TwitchCon. I think we're doing one or maybe 2 sessions at TwitchCon. We've got a meet and greet and stuff like that. So stay tuned if y'all are in the San Diego area, and we hope to see y'all there. Okay. All right. So how are y'all doing today? Everybody doing okay? Will we get intro music back? Absolutely. We're hoping to fix that tomorrow. We were like troubleshooting today. Shoko 2250 is saying my body dysmorphia is getting really bad right now, and I just saw the title wall. Well, yeah, I mean, hopefully you can. We'll talk a little bit about the role of treatment, but I really do think you should get some help for that. Shoko 2250. Thanks for the Prime Gaming sub, AMP lol. What do you think about Gabor Mate? I think he's a fantastic clinician. I don't agree with everything he says 100%, but when I first sort of got into addictions, like clinically, as in starting treating addictions, I loved his book In the Realm of Hungry Ghosts. So I think he's a great example of a psychiatrist who's like very humanistic in their approach, right? So it's not just about diagnostic criteria and things like that. It's like there's a person at the bottom of this, and how do you understand the person? And you know, I think that there are different perspectives. So I think that's his perspective, and he brings a lot to the table. And there are also I think there are certain shortcomings of his perspective, and there are other perspectives that add different advantages, let's say. The book was In the Realm of Hungry Ghosts. Ashes of Dreams saying, Dr. K's topic sounds interesting. Currently try to drop 20 more pounds to improve self-image. Yeah. So let's talk about it, I suppose, right? Okay. Alrighty. Okay. Let's get started. Okay. Yeah, by Gabor Mate. All right. So today what I want to talk to y'all about is something that's a little bit different. I want to talk to y'all about eating disorders and body image issues. And I think that to start off with, I kind of want to dive into a little bit of like a psychiatric history. And then what we're going to sort of discover is that the way that we perceive eating disorders and body image issues is actually like quite gender specific. And I believe there are a couple of changes that are going on in our society right now, possibly due to things like social media, which have suggested to me that we may even have like emerging manifestations of body dysmorphia or eating disorders that are a little bit different in men. So let's start with sort of a historical perspective. So if you look at kind of like psychiatric diagnoses related to body image and the way that people look, we tend to see 2 major buckets. The first is something called eating disorders. So these are things like anorexia nervosa, bulimia nervosa, binge eating disorder. So these are situations where, you know, someone engages in disordered eating. So eating in which they severely restrict their eating, which is the case in anorexia, or sometimes they'll binge and purge. So they'll eat a large amount of food, and sometimes they'll vomit the food later in order to avoid getting the calories and changes to their body image. And so that's kind of like the eating disorder buckets. And then we have a separate bucket, which is body image related issues, where we think of diagnoses like body dysmorphic disorder. So in body dysmorphic disorder, there may be some kind of disordered eating associated with it. But this is a situation where usually people are preoccupied with a particular feature of their physical form, and they feel really, really, really unsatisfied with a particular feature. So sometimes we'll see body dysmorphic disorder manifest in different places. So oftentimes not with a psychiatrist, but plastic surgeons, for example, will see body dysmorphic disorder. ENT doctors will oftentimes see body dysmorphic disorder where someone is very hung up on their nose or their appearance, and people will come in for surgery. I almost wonder a little bit about all of these leg lengthening surgeries that I hear about nowadays, and whether that's actually associated with body dysmorphic disorder. But the key thing is that, generally speaking, in psychiatry, we tend to, if someone is unhappy with the way they look, we tend to bucket them into an eating disorder or a body dysmorphic disorder. The thing is, if you sit down and you talk to these people, or at least this has been my experience, and you ask them, okay, so I understand that you want to get plastic surgery. Help me understand a little bit about why you want this surgery in the case of body dysmorphic disorder, or people who are getting implants in particular parts of their body. And if you talk to someone who's got, let's say, anorexia, and you ask them, okay, tell me a little bit about like what's in your head. So I understand that you're quite restrictive with your eating, or you're careful about what you eat, right? So we don't want to use a judgmental diagnostic word. But when you talk to these actual people, what you discover is that what the root, for me at least, appears to be exactly the same, which is both of these diseases, I think, are manifestations of a core image issue. So when they look in the mirror, there's something fundamentally that they don't like. When they look in the mirror, they see something that they do not like. And then what they try to do is try to move towards an ideal body image in their mind through these different paths. So for some people, it manifests as like restrictive eating. For other people, it manifests as some kind of surgery or whatever else we can see from body dysmorphia. But the key thing is that if you really look at the root, it's that something about the way that I judge the way that I look is unacceptable. So I feel unattractive, I feel unacceptable, I feel like I should look differently. And that's kind of the core feature of both of these buckets. So oddly enough, even though we sort of diagnose them quite differently, like the diagnostic criteria are very, very different, when I sort of think about these patients, I almost kind of treat them the same way, especially in psychotherapy, which is, sure, there may be particular behaviors that are kind of the end manifestations of their core psychological issue. But the core psychological issue is essentially the same, which is not accepting the way that we look, or being very, very bent out of shape about the way that we look. Now, the interesting thing is that if you look at these diagnoses, what you'll sort of discover is that there's a big gender difference in terms of how often people get diagnosed with this stuff. So, for example, anorexia nervosa has somewhere between 0.6 and 2.2% of the population has anorexia nervosa. So we're talking less than 1 in 100, up to maybe about 1 in 50. The other thing that we notice about anorexia is that it tends to have a very, very strong gender skew. So for every man who is diagnosed with anorexia, 3 women are diagnosed with anorexia. We also see this pattern exist in other eating disorders, like binge eating disorder is like about a 2-to-1 kind of ratio. Seems to be a little bit more even. So we know that there are, that women seem to be suffering from eating disorders more than men are. And you could also sort of extend that out into an assumption, or extrapolate that out, that disordered image is more common in women than it is in men. And there's kind of a really interesting reason that I think we're starting to discover, is that our initial diagnostic criteria for something like anorexia was very, very culturally and gender specific. So just to give you all an example, so if we look at the diagnostic criteria for anorexia, or sorry, not the diagnostic criteria. If we look at the screening questions that people ask for when we're trying to screen for anorexia, and by the way, so certain organizations like, primary care physicians in the United States, the standards of care that are determined by the U.S. government suggest screening all women for eating disorders, but not screening all men. Now, I don't think that that is any kind of like discrimination. I think that that's just sort of valid, right? So like, for example, we don't screen men for cervical cancer because they don't have a cervix. We don't ask men to get mammograms on every 5 years to screen for breast cancer because the incidence or prevalence of this illness within a particular gender population doesn't really suggest that screening is appropriate. At the same time, I think what we're starting to discover is that a lot of our assumptions about eating disorders were very, very culturally specific and also gender specific. So for example, as we've learned more about eating disorders, so a lot of the research on eating disorders and diagnostic criteria essentially came out of studying women and Caucasians. And so now as we're sort of starting to see like do more culturally sensitive psychiatry, we're starting to see, for example, that eating disorders and body image issues manifest differently depending on your culture, even your sexuality. So we know that, for example, body image issues in people who are homosexual manifest differently from the way they manifest in people who are heterosexual. We know that, for example, body image issues in the Singaporean and Chinese community are different than in the Caucasian community, are different in, let's say, African communities or Latin American communities. And so we're starting to discover that our initial assumptions about, how we diagnose an eating disorder was very, very culturally and gender bound. And I think this is best exemplified by the U.S. Preventative Task Force's screening questions for eating disorders. So what I'm going to do right now is just read a couple of these questions out to you. So here's how we screen for eating disorders. So, for example, do you make yourself sick because you feel uncomfortably full? Do you worry you have lost control over how much you eat? Have you recently lost more than 1 stone or 14 pounds or 6.35 kgs in a 3-month period? Do you believe yourself to be fat when others say you are too thin? Would you say that food dominates your life? So if we listen to those screening questions, what we notice is that these are screening questions that have to do specifically with weight loss. And that's because if we look at people who have anorexia, right, they're very, very, very concerned about having a low weight. But if you kind of go back a little bit and step away from the manifestation of the eating disorder and go to the core issue is when I look in the mirror, I really, really don't like what I see. And this is almost like an irrational belief, right? Because I can look at myself and I can be unsatisfied. That's a normal human experience. And we can move to make changes to our diet or exercise or whatever to start to feel better about the way that we look. The key thing, though, is some of those beliefs are rational and some of them are irrational. And how do you tell the difference? Well, it's like, do the beliefs change depending on your appearance? So if I look in the mirror and I say, hey, I'm a little bit overweight or I'm overweight, and then I proceed to lose 5 pounds or lose 10 pounds, and then when I look in the mirror, does my response change? So as I start to get healthier, do I feel more satisfied with myself? Or do I persistently believe that what I see in the mirror is unacceptable? And that's really the key difference between sort of unhealthy body image and healthy body image, which is that, is it responsive to feedback? And so what we tend to see is our screening questions are really focused on weight loss. But really the core issue here is a body image issue. And as we've done more and more research on different cultures and different genders, what we're actually starting to discover is that core issue of body image manifests in different groups of people in different ways. So for example, if you try to screen a man for body image related potential diagnoses, the screening questions that we have, which are screening questions for eating disorders, may not actually apply to men because, as we've discovered and we're about to get into, body image issues for men are actually quite different. So as we've learned a little bit more, we've discovered, okay, what kind of body image issues do men have? So I think these are really best described by sort of like the mesomorphic ideal. So I want to say maybe 60 or 70 years ago, there was a physician who sort of described that there are 3 body types. So one is sort of like thin and bony. One is what we would call kind of like big boned. So these people tend to have like rounder frames or stockier built, tend to be like wider as opposed to taller. So we sort of know that there are these different kinds of body types. And the middle type is something called mesomorphic. And so mesomorphic people have wide chests, narrow waists, so wide like shoulder length actually, so the width of the shoulders are wide, narrower waists compared to shoulders, a high degree of muscular definition, so like very, very visible muscles, a low body fat percentage. And so this is kind of like the mesomorphic body type. And so if you look at sort of perceptions of male ideals and you look at men and the kinds of bodies that they aspire to, they tend to essentially focus on this mesomorphic ideal. And so the key thing is that if I'm interested in a mesomorphic ideal, if you ask me, have I lost weight over the last, 3 months, that's something that I'm not going to be interested in. My goals or my insecurity in the way that I appear won't map on to the screening questions, right? Because what I actually want to do is I want to put on weight. I want to build muscle. I want to be bigger. I'm not interested. It doesn't bother me that I lost any weight. Like, that's not an issue. I don't try to control myself by slimming down, slimming down, slimming down. What I actually want to strive to do is bulk up, bulk up, bulk up. And so as we're sort of learning more about changes in male body image and body image related diagnoses, what we're sort of discovering is that the old systems of diagnosis don't appear to map onto men kind of nearly as much. And so there are even some studies of there's kind of a new diagnosis that people are kind of considering called muscle dysmorphia. So this is where people are like really, really concerned about their lack of musculature and really strive to be like more muscular. And sometimes to the extent of really engaging in very harmful behaviors like anabolic steroid use or things like that, that actually like really negatively impact them. So muscular dysmorphia is an example of a new diagnosis that people are starting to explore. If you talk to people who have muscular dysmorphia or sort of in that vein, and by the way, men, about 2.2% of men have muscular dysmorphia, according to some research. So remember, once again, like the prevalence of anorexia for women is also around 2.2. It's like less than 1% for men. And so what we're starting to see is that if you have a core image with the way that you look, and for women, it may be that I need to be thinner, and women have unhealthy ideals that are portrayed to them by the media and things like that. But those ideals tend to be like gender specific, right? So for women, it tends to be focused on thinness. For men, it tends to be focused on muscularity. And if you take those men who are very, very focused on muscularity and feel like they have insufficient, or their body is not acceptable enough, and you start to ask them more specific questions, what you sort of discover is that you kind of get the same number of people, men and women, who are unsatisfied with their body. And the number tends to be around 2%. So that's kind of like an interesting discovery. So as we've done more and more research on men and how their appearance, what we've started to discover is that it just looks different in men. That the root is still the same. That when I look in the mirror, I'm fundamentally unsatisfied with what I see. But the way that dissatisfaction with my appearance manifests in the kinds of questions that need to be asked are not actually the standard screening questions for things like eating disorder or even body dysmorphia, which is usually focused on a particular feature like your nose or chin or whatever. So this is kind of a really important discovery, because I think what it sort of suggests is that probably for the past 2 generations, we've had men who have probably had something similar to an eating disorder or a body dysmorphic disorder, but our diagnostic criteria have not really been able to pick that up. This is becoming increasingly problematic because what we're sort of seeing is that changes in social media and technology tend to be propagating this phenomenon. So this is where I just made a statement that for the past 2 generations, there's a chance that we've been sort of missing diagnoses for lots of men. But that may not necessarily be the case. What we could actually be seeing is that actually it wasn't that bad, let's say 1 generation ago, 50 years ago, 60 years ago. But now what we're seeing is an acceleration of body image related mental health issues in men because of things like social media. And so as we've done a lot of research, we've discovered a lot of really interesting things. So the first is about 85% of college students in one study that was done in France are unsatisfied with their muscularity. Now, this doesn't mean that they have muscular dysmorphia. What this sort of means is that 85% of college-aged men in France, at least, and this is, I think, pretty generalizable, tend to be pretty unhappy with the way that they look. And that probably is influenced by social media. So what we sort of see is that much like the same factors that drive unhealthy body image in women also drive unhealthy body image in men. And social media is a big part of that. So as we tunnel down and we start to ask men who feel uncomfortable with the way that they look, okay, what's going on in your life? Like, where do these thoughts come from? What has your upbringing been like? What we discover is actually quite shocking. Okay, so we're going to talk a little bit about that. So here are a lot of features that people don't really consider when, let me actually rephrase that. So what am I actually trying to say here? So as awareness that body image issues in men may be worse or look different from body images the way that body images look in women. As awareness of this has grown, researchers and clinicians have started to dive more into men who struggle with body image issues. And what they've tried to do is figure out, okay, how big of a problem is this? And more importantly, how do we detect the problem? How do we catch all the people who have fallen through the net? And what we've discovered is actually incredibly fascinating. So the first thing is that anywhere between 25 and 68% of men with body image issues have very, very critical or emotionally abusive parents. So emotional abuse by parents, or being neglectful, or parents chiding your appearance or making fun of your appearance, seems to correlate very, very, very highly with having male body image issues. Once again, this may not be very different compared to women. So women may experience sort of the same numbers, and that's sort of shared, right? So we know that if you've got critical parents, that there's a greater chance that you'll develop body image related issues. Other really shocking things include, so sometimes we'll see high incidences of trauma. So including like 28% in one study of men with body image issues were actually sexually abused. So that's a shockingly high statistic that I think is probably a bit of an outlier. But we definitely see a history of abuse or emotional neglect or very, very critical parents, and especially parents who are critical of appearance. Another thing that we tend to see when we explore what's it like to have body image issues as a man, we tend to see that there's a lot of social anxiety. And so this is kind of interesting, but it seems like one of the most common manifestations of body image issues is what men will describe as socially anxious. So if you kind of tunnel down into this, what you find is that they compare a lot, and they also do upward comparisons. So some people in their head will be constantly or commonly comparing themselves to someone else or some kind of ideal, and will be falling short. The interesting thing is that when you ask this person, okay, like, what do you experience? They won't say, oh yeah, I have body image issues. What they will describe subjectively is that I'm socially anxious. Because what that sort of means is that when they go into social situations, why do they think they have social anxiety? It's because their mind is constantly making image-related comparisons with other people around them. That's really what their manifestation of social anxiety looks like. We also tend to see that men with body image issues are high on the alexithymia scale. So alexithymia is the inability to recognize or name your emotions. So they tend to feel a lot, but they're not really sure what they feel, and they're almost colorblind to it. And when we become colorblind to our feelings, what tends to happen is we start to form complex, almost logical narratives in our head about the way we feel about ourselves and the way society is and things like that. So those emotions, we don't recognize them as emotions. They almost transform into something like logic in our minds. And so as we tunnel down into like what we know about men who struggle with body image issues, and this is another huge problem with the research, is that most of the research, I would say I read about 20 papers in preparation for this, including textbooks and things like that. Or sorry, not including textbooks and stuff. And I would say about 30 to 50% of the papers that I read actually focused on bodybuilders. So this is another problem that we have on research for men with body image issues, is that we tend to focus on people who are bodybuilders and sort of very, very obsessively exercise. Whereas my guess is that actually a lot of what we're seeing in terms of male mental health problems may be more related to body image issues than something else. But it manifests in kind of a different way. It manifests as social anxiety. It manifests as shame. It manifests as all of these different things. But as you actually tunnel down, my guess is that there's a lot of men out there who fundamentally don't feel good about themselves when they look in the mirror. Now, some of this may be within the normal range, right? It's not necessarily a psychiatric illness, like we sort of mentioned. 85% of college men in France, in a particular study, felt really, really unsatisfied with their appearance. And I would imagine that upwards of 50% of women, I don't know exactly what the number is, also probably feel very dissatisfied with their appearance when they look in the mirror. What we're sort of noticing, though, is that the manifestations of these body image issues may be masquerading as other things. So they'll manifest as something like social anxiety or social withdrawal, which is very common for men with body image issues. They also manifest as other things like emotional numbness, as well as, what was it? I was going to say one other thing that's really common. Emotional numbness, social withdrawal. Yeah, like social isolation is another piece of it. And the other really interesting thing is that even if you look at this whole like alpha beta thing, right? So the alpha beta thing, if you really look at what's the foundational belief for this alpha beta conversation, at the bottom of the whole belief system is an image issue, right? It's that there's a particular ideal. Those people are the alphas, and people who don't fit into that ideal are the betas. The other interesting thing about a lot of the alpha beta dialogue or discussion is that it shares a lot of features of that irrational logical belief system, right? What do I mean by illogical? I mean, logical, irrational belief system. What I mean is that it's internally consistent in terms of logic, but it's not actually like based in science, or more importantly, people who make progress in terms of their appearance don't actually feel better about themselves, right? Once a beta, always a beta. And once an alpha, always an alpha. So these kind of unchangeable qualities, I actually wonder if a portion of those people are more in the bucket of actually having like a masculine body dysmorphia kind of diagnosis. Now, we can't diagnose people over the internet. That's not what we're designed to do. And we're also not, we don't even know that that diagnosis really exists. The reason that I'm sharing this stuff with y'all is because I think that these core issues of body image are starting to manifest somewhat differently in men. And especially because of things like social media, we're seeing people check a lot of these boxes, right? So this is sort of the core reason I'm doing this lecture today, is because I think if you look at people on the internet, they check so many of the boxes of what we've learned for like male-related body dysmorphia. So emotional neglect in childhood, sometimes even rising to the level of emotional abuse, hypercritical parents. We're also seeing social avoidance, social withdrawal, a lot of appearance based on comparison, and specifically upward comparison. So a lot of these people's thoughts are focused on how I look versus how someone else looks. We're also seeing a high degree of alexithymia amongst a subset of men on the internet. And then the last thing is that there's sort of this intractable belief that no matter how much I change, it's never going to be enough, right? So other people will be able to exercise, but I won't be able to exercise. Or even if I exercise, it won't be enough because my jawline is insurmountable. So if we go back to thinking about, okay, what are like healthy responses to sort of being unhappy with the way that we look, a healthy response to it is, okay, let me go exercise. And then when I look in the mirror, I feel better about myself. But what I'm noticing is that there's a subset of people who are men on the internet who, no matter what they do for their appearance, it never feels like it's enough. And so when I see all of these sort of research-based risk factors for body image issues, and I see a diagnostic system that was sort of developed primarily by working with Caucasian women, I start to scratch my head and wonder, okay, if you check all these boxes, do you really have social anxiety? Or at the core of all of this stuff is when you look in the mirror, no matter what is actually there or what you do, you're always going to feel unsatisfied by it. And if the answer to that question is yes, then I think we could be seeing sort of an emerging body image related diagnosis for men. So if you feel like you kind of fit some of these boxes, and this is the really challenging thing, is I would encourage you to go see someone like a therapist, because, and this is also where things get a little bit tricky, because the therapist is also going to have to understand that like you may have a body image related issue that may not look like anorexia or binge eating disorder, that it may manifest in a slightly different way or drastically different way. And so this is what's really tricky, is that we're, even as psychiatrists, we're recognizing that the world is changing, people are changing, technology is changing the way that we perceive ourselves. And so we really aren't entirely caught up with it. So even things like muscle dysmorphia, which is the most common kind of male-related diagnosis that's studied, is not an official diagnosis. So it's like a proposed new diagnosis. So if this stuff kind of resonates with you, I'd strongly encourage you to get evaluated. But even if you get evaluated, consider that the default language that your therapist has may not really perfectly apply to this situation. And you may need to be a little bit more vocal about sort of sharing your thoughts and feelings, and sort of almost not really convincing, but really giving your therapist a window into what your mindset truly is. So hopefully that's helpful. Questions? Let me see if there's anything else we want to talk about. Oh yeah, there's one other thing that I wanted to talk a little bit about. So there are also a lot of things in social media which I think could be propagating unhealthy body image issues that we actually don't think of as propagating unhealthy body issues. So obviously there's a bunch of stuff on social media that's like bad, makes us feel bad about the way that we look. But there's all kinds of things that are actually kind of like more acceptable, right? So if you look at someone who's got anorexia, and they will frequently post a lot on social media. By the way, so this is a little bit different, but men who have body image issues, one of the things that correlates with how severe their body image issues are is lack of posting. So oddly enough, like people who are very, very inactive, or inactive in the sense that they don't post selfies. So like for men, for example, correlation with body image issues posting selfies is inversely correlated with body image issues. So the worse that you feel about yourself, the less likely you are to post. Whereas there's some data that suggests that the opposite is true of women. That's just like one example. But I think a good example of this is like cheat days. So when we look in social media, like and people post about cheat days, right? So this is something that is generally viewed as like good and healthy and acceptable. But if you really look at it, like what cheat days kind of are is like a binge pattern of eating, right? It's like eating 2,000 calories in a particular day. And we'll sort of like socially glorify this in a lot of ways. Other examples of stuff that has been shown to really correlate with negative body image issues, especially for men, are things like fitspiration. So these are situations where like, you know, we'll have posts and people will sort of accept that this is an ideal that we should all strive for. So even a lot of this like body, this fitspiration, like fitness oriented content that people make, like food related content that people make, may actually be having like a negative damaging impact on our mental health, even though it's sort of like lauded, right? So these people who are like fitness influencers, for example, like we don't think about them as damaging in any way. We think about them as inspiring. And I'm not suggesting that these people are culpable in any way. I'm just sort of saying this is kind of how our society has evolved, where we sort of like honor those people. We raise them up on a platform. We're like, wow, I really want to look like that. And what we're starting to discover is that there may be some negative impacts of that kind of thing. We're also seeing, just as an interesting tangent, there's another diagnosis that people are proposing, which is orthorexia nervosa. And orthorexia nervosa is like a very, very disordered perception around what you eat, but it's not about losing weight. It's about like wanting to be healthy. So we'll see some horror stories of parents, for example, that will deprive their children of particular like nutrition because they're very, very, very focused on like a particular, dietary style that they view as like fitness oriented. And in the most tragic cases, what we'll actually see is like children who are removed from parents or will suffer like, medical complications. In drastic cases can even pass away from those kinds of nutrient deficiencies. And so if you really look at that, like, what's going on here, we're starting to see a lot of different, almost obsessional beliefs about particular kinds of food. And in that case, is it a disorder? Well, we'd sort of say, yeah, in psychiatry, because one of the ways that we define a disorder is that it impairs function or damages your life in a particular way. So if you're so careful about the way that you eat because I'm on this, like I saw this diet recently where people were eating raw meat and they were getting like parasitic infections, because that's what happens when you eat raw meat is you get parasitic infections. And so that would sort of like hit the threshold of what we would consider a psychiatric illness because it's negatively impacting your function. Now, I'm not diagnosing anyone on the internet who's doing that sort of thing. I'm just sort of saying, in general, how do we define psychiatric illnesses? Well, the line is, does it hurt you? And if it hurts you in some way, then we'll sort of consider it a potential psychiatric diagnosis. My point is that there's a lot that's changing on the internet, and these core psychological features of, disordered eating or beliefs about health or body image seem to be manifesting in different ways. And so y'all need to be very careful about this kind of stuff. And if you're finding yourself having very, very rigid beliefs about what you should be eating, or rigid beliefs about how you feel about yourself or what you see when you look in the mirror, if you find yourself making upward comparisons and sort of assuming that there's an ideal body image that you will never meet, this could be one of those emerging body image kind of issues, and I'd encourage you to go seek help. Questions? Yeah, orthorexia is really interesting. So Fig 012 is saying, if I fit every description you gave, what are the odds of that being my diagnosis? The odds are very low. Okay. So understand this. These are not official diagnoses. That's actually my whole point, is that I think something is going on in our society where the shape of mental illness or mental suffering is changing. And it's changing so fast that our diagnostic systems are hopefully outdated, but sometimes are like completely off base. And so my point is that like I'm starting to wonder whether a lot of the people that I've worked with who are very, very like into this alpha beta mindset, or who describe themselves as being like emotionally numb and socially anxious, but when you tunnel down and you actually ask that person, okay, like what goes on in your head? At the root of it is, I don't like the way that I look. And that person is way more handsome than I am. They have a mesomorphic body type. I don't have a mesomorphic body type. And that's the foundation of all of the thoughts. So because I'm embarrassed about my appearance, I don't want to go out. Because I'm embarrassed about my appearance, I don't want to take a picture of myself. Because I'm embarrassed about my appearance, because I don't look like this particular person, I experience a lot of social anxiety and social withdrawal. And when we think about these terms, social anxiety and social withdrawal, we think about social anxiety disorder, right? We think about primarily anxiety-related disorders instead of body image-related issues. And that's my point, is that I think that we may be like over-diagnosing people with social anxiety who actually have body image issues. And that's actually like kind of the wrong move, because what that person may need is something different. These mesomorphic, etc. body types, do they even exist? Sort of. My answer is sort of. There's some evidence of them, but it's not, it's an area of research that basically got abandoned like 40 years ago, 50 years ago. So Lord Butt Pirate is asking, how about body dysmorphia due to height? This is another thing that I'm actually like noticing. So I don't know if y'all have heard about this, but there may be body dysmorphia related to height too. This is what I think needs to be explored. But there's a lot of interest nowadays in leg lengthening surgery. So I remember the first patient that I saw, which was 7 years ago, who was interested in getting a leg lengthening surgery and was a college student. And it wasn't, I don't think it was legal or performed in the US at that point. So they were telling me that they had found a surgeon who performed this surgery in a foreign country. They wanted to fly to the foreign country, get leg lengthening surgery, and like, because they had to do it overseas and it cost a certain amount out of pocket and stuff like that. And you know, that was the first time I had heard of it, and it sounded very, very unhealthy to me. So we sort of treated that person kind of like a body dysmorphia of sorts. But now what we're actually seeing is that like a lot more people are getting leg lengthening surgery. And I don't really know what to think about that. Like there's a part of me that's highly concerned that this could be another example of a body dysmorphia, where people are like essentially going to a surgeon to fix something about their body, right? But it may not be body dysmorphia. Who knows? It could just be societal stuff. It could just be like we allow people to change their appearance, right? So it's not like anyone who goes and gets a rhinoplasty, a nose job, it has a psychiatric illness. We just allow people to change their parts of their body, and we don't necessarily diagnose them with an illness. Like people are allowed to change stuff. And so where's the line? The short answer is like, we don't know, but this seems to be changing very rapidly. That's why we're sort of trying to bring it to your attention. So one person is saying, I'm short, but that sounds way too extreme and painful. And someone else is saying leg lengthening is pretty safe. So I've heard a lot of mixed things about leg lengthening surgery in the sense of safety. Will you come out of the surgery alive? Sure. But I haven't looked at outcomes on this. It's something that I'm really curious about. But I have heard that there can be quite debilitating pain that may not resolve actually after surgery. So I'm super curious about what the actual numbers show of like long-term outcomes and pain specifically. Yeah, it's kind of wild. Yeah, it's super wild. I mean, if you, yeah, so what they do is they break bones and then they'll insert, I think, like metal plates or rods or screws, and then they'll like, you just, so you just like, you don't lengthen the bone, you actually break it, and I think you insert something in the middle. So, and I've heard that, you can do it below the knee, above the knee, or both. So I don't really know what the appropriate, I don't know much about outcomes and stuff. Like, I'm not an orthopedic surgeon, so we don't really know. So I'm really curious about it. You guys want to do some quick checking? Let me see if I can find some info on it real quick. Let's see. Yeah, I don't see much about this. Let's see. How about third leg shortening? Let's see. Yo. Hi. Is now a good time? Sure. We're just looking up random stuff on the internet, but you can come in. What's up? I'm trying to look up some outcomes about leg lengthening surgery. But what's up?
Hi.
Hi.
I just wanted to tell chat about first session on us.
Okay.
Can I do that now?
Sure.
Okay. Hi, chat. How's it going? Can I? Here.
You want to sit? Sure.
Yeah.
I shall move. Go ahead.
No. I'll just sit on you.
No,
Okay.
the mic and stuff is all configured.
Ah. Hi, chat.
Scoot in.
Scooting.
Okay.
I look very blonde on this. Well, hey guys. So I wanted to tell you guys a little bit about a promotion we have running right now. I don't know how much of it has come through, but we are wanting to sponsor your first coaching session, so that way you have a way to try coaching if you would like to. I think we've talked about Healthy Gamer coaching quite a bit. We built it with you guys, for you guys. Back in 2020, during Mental Health Awareness Month, we had kind of an idea of, hey, it'd be so cool if we could do peer coaching, which means somebody who gets it, that is trained by Alex's curriculum and can work with other people on the internet to just build a better life. So Alec has put kind of and I feel like Alec's really humble about this stuff, so I'm going to brag about him because I don't think he gets to brag about himself. So essentially what happened is Alec was teaching kind of the most promising psychiatrists, right, as a faculty member of Harvard Medical School. So the things he was teaching, he was kind of like, really everybody should know how to do this. And the things that he was teaching wasn't necessarily something that only a physician should know. It wasn't something that necessarily only a psychiatric patient would need to go through. So what we did was build Healthy Gamer Coaching. And this was, we started doing this 3 years ago, almost to the day, 2019, fall of 2019. And since then, we've had, I think we're on cohort 10. So we've gone through 10 rounds of coaches that have gone through this curriculum. And what's been kind of cool is we measure, right? Because we're very just all the way he is, he won't do anything unless we can measure if we're doing a better job or not, which I love. And I think it's really important because one of the things that we've seen is really lacking in the mental health space is just the idea of accountability, right? So like how much accountability does the person that is working with you actually have for you getting better? And the answer is, in the industry, really not a lot of accountability, but that's something we wanted to change. So when we were looking at the data, we wanted to see, okay, can we actually change somebody's levels of depression or anxiety? And we saw that through the coaching program, that the depression reductions, the anxiety reductions were significant. Like, 30, 40% reductions in depression, anxiety, really significant. And then we were saying, well, we don't want to mislead anybody. We don't want to necessarily say coaching is going to cure your depression, because that's not really how it works. Because the other side of what we measure is an increase in a sense of life purpose and an increase in a sense of control over your life. And we actually built the coaching program to increase your positives. As a result of that, the negatives came down. But I think the coolest thing is, with every cohort we train, we can see that each cohort of coaches can at least maintain that, but even better, they are moving the needle further and further. So the coach curriculum has gone through, I think, 7 iterations at this point, each with demonstrated improvements and results. The coolest part is that what we call the PSF, the post-session feedback forms, we're seeing that the coach and client fit is getting better and better. So clients are enjoying their coaching experiences more and more. All this to say, some of our best, most promising coaches just went live on the platform. They just added their availability a week or 2 ago. And we thought, given all of the support that you guys have given, we wanted to be able to let you guys just try coaching risk-free. So your first session is on me and Alok. You can sign up using the coaching command and just check it out if you want. Again, it's risk-free. If you love it, great. If it's not for you, no problem. If you're saying, hey, I'd really like to try this, but let me try it with a different coach, our customer service, we have customer service now, so we can help you get matched with the person that you think will do the best for you. And kind of in the spirit of progress and everything coming together kind of full circle, all of our guides to mental health are included with coaching. So it's kind of our best deal ever. First coach session is on me, and ADHD guide, along with our guides to meditation, depression, anxiety, is all in there. So please check it out if you're interested. And if you've gone through coaching, I see you guys in chat and on Reddit and on Discord. Let us know how your experience was. If there's anything we can do better, we're always listening. And yeah, it's built for you, with you, with your support. So thank you very much for all your support, and I hope we can help. Cool?
Yeah.
You bailed.
Yeah, well, there's no room for me to sit.
I know. We need another chair here.
I'm still thinking about...
You want to get leg lengthening surgery?
No,
Okay.
I don't want to get it.
I don't want it
I was
either.
thinking about that either. So I was just thinking actually about, so we do have a lot of people who will come into coaching with like confidence related issues.
Yep.
And so I think we're pretty good at helping them. But it's actually like lectures like this that actually make me wonder whether, when it comes to something like confidence, like, is it a body image thing that is actually better served by a therapist? Because if it's like, if the goal is, body image issues and you want to start exercising, you want to start eating healthy, you want to start feeling better about yourself, I think that's something that a coach can absolutely help you with. Mm-hmm. My fear is that sometimes what we actually see in coaching is like probably a small percentage of those people may actually need to see a therapist.
Right.
If they've got a real body image issue.
Your coach will let you know, right? Our coaches know if something is going outside their scope, they're very clear on.
Yeah,
okay,
they're pretty clear about, recommending clinical evaluation if something seems to be outside of their scope.
Yeah.
But
I think confidence at work too, we've seen really good improvements there with the career program, where confidence in your personal relationships is kind of one thing, but if it's holding you back at work, which I've seen happen quite a lot, that's kind of a different thing that our career coaches have been really great at. Okay.
Cool.
I'm going to bail.
Okay, we've got stuff to do, so.
Bye, guys.
Can you close the door?
Yeah.
Most issues with yourself, which you feel are related to your self-image. Yeah, so we're going to talk a lot about that today. So let's do a quick poll. Do we have mods? Mods. Why don't we see what y'all want to do today? Interesting. Do we have mods? No? Okay. Then we're going to have to, I will do the poll. I'm going to put my big boy pants on. Nope. Doesn't work here. GG. No mods. Y'all want to riot? Sounds good. Are you going to do riot games? Huh? Okay. Yes. I will do it. Wait, why are people tagging me? Oh, Trinian. Okay, you're there. Okay, it's okay. I got it now. Okay. We're going to do a poll. Y'all ready? So, let's do a quick poll. I'm going to show this to y'all. Thank you very much, mods, for being here. We love you for it. So, let's take a look at this. All right. This is not what we're going to be talking about. I just figured I'd look at this. Save cosmetic leg lengthening for short stature, long-term outcomes. Okay. Excellent final outcomes were all achieved in all patients. Okay, it looks like this study doesn't look at pain, though. Okay, that's kind of interesting, right? So they're looking at outcomes, but I don't think they're looking at pain. Anyway, so here's what we've got. Realize I don't fear rejection. I fear being accepted, and this might be what's holding me back. This is going to be a post about, we're going to talk a little bit about fearing acceptance and self-sabotage. My boyfriend is too competitive when we play games, and it's making it impossible to play anything with him. So this is going to be a post about relationships, conversation, and communication skills. Shame, lots of shame. And change my view, self-diagnosing mental illness is not valid. What do y'all want? Am I doing it? Mod's doing it? Okay. Okay, let's do shame, lots of shame. So exploring shame, boyfriend too competitive, and fearing acceptance and self-sabotage. Okay, let's go. Oh, there's a poll already active. Oh, thank you, chat. I mean, mods. Thank everybody. Let's see, what do? Okay, fear of being accepted. Okay, and self-diagnosing. Okay. Okay. Let's do it. Sounds good. So we're actually going to start with self-diagnosing. Okay, and kind of get that out of the way. I think it'll be maybe a touch on the shorter side, so let's just go ahead and do that. So, let's take a look. Change my view. Self-diagnosing a mental illness is not valid. I'm in high school and I see people do this all the time. They say they have ADHD and I ask why I can't focus. People say they're depressed. How do you know? I'm sad today. It's honestly just a cycle of people self-diagnosing themselves without proper research/medical diagnosis. I understand sometimes we know ourselves the best, but whenever it comes to something serious that you need an actual therapist specialist, self-diagnosing can be so harmful. Self-diagnosing can be so harmful. For example, there's a girl in my class and she told me she has autism and ADHD. Then she told me she hasn't actually gotten checked, but she still knows. Afterwards, as I spent more time with her, she started diagnosing me with autism also. She told me I have the symptoms, and I asked her how she knows, and she told me she looked online and I follow exactly what it says, and that she has it too. I'm not mad at her, but I do think it is ignorant. Self-diagnosing cannot only be harmful to yourself because you might be wrong, but harmful to others because you might spread wrong information. I understand US healthcare sucks and getting therapy and everything is so expensive, but that doesn't mean people should be telling others what they think they have. Edit, when I say valid, I mean end result. People shouldn't be saying they have this and that and then call it a day. Self-diagnosis should only be a basis in order to seeing if you need specialist help or not. Many people I know self-diagnose and don't seek further help, and then they end it on the self-diagnosis. Therefore, it's not a valid conclusion. Okay. So this is something that I'm seeing a ton of nowadays, by the way. So we're seeing a ton of self-diagnosis on the internet, right? Where people will like say, oh yeah, I have autism, I have ADHD, I have this, I have multiple personality disorder, things like that. Like people will diagnose themselves with all sorts of things. And is that kind of valid? Well, I know this is going to sound kind of weird. My short answer is no, it's not. But there's a pretty big but in there as well. So what I'd love to do is share with y'all why I think, first of all, it's so easy to diagnose yourself on the internet. Secondly, why people diagnose themselves from like research on the internet. Third, what's actually wrong about it, right? Because as we'll see, they're actually quite logical in the way that they approach it. But really what the shortcoming to self-diagnosis is, and actually what's hard, the hard part of being a physician, which we'll get to, is not in diagnosing someone. Diagnosing someone is actually not the hard part. It's very easy to come up with a diagnosis. We'll actually share with y'all why I think what's the main thing that's missing with self-diagnosis on the internet, which happens to actually be, in my opinion, kind of the biggest value add that doctors bring to the table. And then we'll talk a little bit about what's the big caveat, right? So, and how to approach this if you're someone who has diagnosed something on the internet, or if you think you have something, how to approach that. So let's do each of those kind of in order. So the first is that this generation is the best generation in terms of, like, the digital generation is the best in terms of being able to find answers for themselves. So we're like more effective at it than any generation prior to us. There's also more high quality information. So for example, if you look at Wikipedia is more factually correct than encyclopedias, which is what I grew up with. When I was like a 10-year-old kid, we used to have like, you know, a pile of encyclopedias. And if I needed to know something, I would go like look it up in the encyclopedia. So we're like actually really good at finding information. There's actually a lot of high quality information out there. And even if you look at some of these things, like, you know, people will look at Mayo Clinic or Cleveland Clinic or whatever for like information on ADHD or autism. And they'll sort of find that, okay, like, oh, this really does sound like it fits me. So it sort of makes sense because there's actually good quality information out there. The last thing is that you tend to know yourself in a way the best, right? So you know what you experience, you understand subjectively what it's like. And so if you kind of know what your day-to-day is like and you read something from the Cleveland Clinic, like that's a high quality source, right? And you can kind of end up making a diagnosis because at the end of the day, the list of diagnostic criteria is boxes, and you check a lot of those boxes. So it sort of makes sense that here's a reputable source that gives me a set of check boxes. I check a lot of those boxes. This is my experience. So this is what the diagnosis is. Kind of makes sense. Another big driver for this is that a lot of people are looking for insight into their lives. So one of the most amazing things about receiving a psychiatric diagnosis, for some people, by the way, for some people it's stigmatizing, but for some people it's liberating. Because for some people, I've struggled my whole life and I haven't understood why. Am I cursed? Is this just like, am I broken? Am I messed up in some way? And for some people, getting a diagnosis is liberating because it offers an explanation. Now I understand why my life has been this way. Now I understand why I behave this way. Now I understand why my mind behaves this way. And that understanding that you're not fundamentally broken, but rather that you have a particular diagnosis which is more responsible for your situation, can be incredibly liberating. In some cases, it can be so liberating that it leads to a lack of responsibility on the patient's part, right? So this is something that we also see, is that when people get diagnosed with mental illness, especially a psychiatric diagnosis, that being sick entitles you to particular benefits. Now, I know this may sound a little bit weird, especially if you're suffering from mental illness. You're like, there's no way that this is like worth it. It doesn't entitle me to anything. It just makes my life objectively worse. We're not disputing that it is a net loss or net negative. But what we do know on research on people who get diagnosed with things is it's not just mental illness, that once you get some kind of diagnosis, people essentially cut you some slack, hopefully, right? So we know that, for example, if you get diagnosed with cancer, bosses tend to be kinder to you, things like that. Mental health is a tricky situation because a lot of times when you get a diagnosis, people actually discriminate against you. But sometimes people with mental diagnoses, especially like ADHD, they feel like they have a good reason for their lack of performance. And sometimes people will even like cut them some slack, right? Oh, I'm sorry, I'm late today. I've got ADHD and it's really hard for me to get organized and out the door. And as people are becoming more and more compassionate, as we're actually destigmatizing mental illness, what we actually discover is that there's more latitude given to people who have diagnoses. I'm not saying that that's right, wrong, or indifferent. I'm not passing a moral judgment on that. I'm just making an observation about what I see. So as we can see that there are good reasons and good sources to make diagnosis. Now what we're going to get to is, I think, the core reason why it's, generally speaking, not a good idea to make a final diagnosis about yourself. And the main reason for this actually has to do with what doctors do. So the hard part about being a doctor is not making a diagnosis. So if we think about what is a diagnosis, let's say there's 5 features, and if you check 3 out of 5 boxes, you have the diagnosis. And so if you go to like Cleveland Clinic and you look at their website on, let's say, bipolar disorder, there are going to be 9 diagnostic criteria, and you need more than 3, but let's just assume 3 out of 5. So people will do is they'll see like, oh, I checked these 3 boxes, so I must have this thing, right? So like I checked the boxes, so it sort of makes sense. There's a reputable source that says that if you check A, B, and C, you have the diagnosis. Now, the challenge is that this is actually not what makes being a doctor hard, because let's say that I have a diagnosis like hypothyroidism. Okay? And hypothyroidism has features like hypersomnia, sleeping too much, low energy. Sometimes it can have cognitive changes. It can also have increased weight. So we'll see weight gain. So these are all features of hypothyroidism. And what I could do if I'm a doctor is I could get people who have, let's say, major depressive disorder, for whom diagnostic features include hypersomnia, weight gain. Oh, by the way, decreased mood is also over here. So low mood. Cognitive impairment. Low energy. And low mood. Right? So these are both features of all this stuff. So what could happen if you were a bad doctor is that if you were an endocrinologist and 100 patients with MDD come into your office, what you would do is diagnose all of them with hypothyroidism. If you're a psychiatrist and 100 patients come in with hypothyroidism, you could diagnose them with MDD. So the hard part about being a doctor is not making a diagnosis. The hard part, what we really study for and work towards, the reason that we order tests is not to make a diagnosis. The reason that we order tests is to rule out diagnoses. And the hard part of being a doctor is the differential diagnosis. And this is the big problem that I see with self-diagnosis, is that people don't construct differentials. You may check 3 out of these 5 boxes, but like you can check literally all 5 of these boxes in both of these situations. And depending on what pops up on your Google search, you'll diagnose yourself with MDD or hypothyroidism. Does that make sense? So like, I'll give you all just an example of how complex differential diagnosis is. And this is why we do diagnostic interviews and diagnostic tests and diagnostic exams and physical exams. Because we'll ask 1,000 questions that the person themselves won't ask themselves because they don't know to ask it. So let's say that I have difficulty with focus and I'm on the internet. And then I conclude I can't study. I'm having trouble with studying. I conclude I have ADHD. Easy, right? Because I have difficulty focusing. I can't study. My mind wanders. But if we really look at the differential for difficulty with focus, there's all kinds of other things. Like you may have a vitamin deficiency. Right? So like, for example, B12 deficiency, iron deficiency, what else? Vitamin D deficiency. These could all lead to problems with focus. Other examples are like there are other psychiatric illnesses which can lead to a lack of focus. So like, for example, major depressive disorder. So you could be depressed. People have difficulty studying when they're depressed. You could even be hypomanic, right? Usually those people study better, but not always. There are also other things like maybe you have an anxiety disorder. So like when you're anxious, you're going to have difficulty focusing because your mind is racing 1,000 miles a minute. And you're thinking about all kinds of things. You can't focus on your school because, oh my God, what's going to happen if I miss my package? I won't have my package. I'm going to go home. I won't have the gift for Christmas. If I don't have the gift for Christmas, people are going to get pissed at me. It's going to create so much drama. I can't miss the package. I can't miss the package. How are you supposed to study for your final exams when you're paranoid about what's going to happen at Christmas? Other examples include things like PTSD. Oh yeah, like I can't focus on school because I'm having nightmares and flashbacks. And that goes to like other stuff as well. Like what about sleep disorders? Maybe the reason that I can't focus is because I have sleep apnea. I'm literally having 60 apneic episodes, which creates a stress response similar to drowning. That's what my body thinks is going on. So I drown for 90 seconds, 60 times a night. And then my sleep is all messed up. Maybe that's why I can't focus. Or we have something like a circadian rhythm disorder. And what does that mean? Well, that means that when I try to study, when I go to class at 10 a.m., my biological clock is messed up and my body thinks it's 3 a.m. So it's like half asleep. Like, can you imagine for the average person going to class, like chemistry class at 3 a.m. when you're dead tired and your body's telling you to go to sleep and you're struggling not to pass out? Very hard. And then what happens is maybe you pound the caffeine, but like your body still thinks it's the middle of the night and you have a circadian rhythm and it's all out of whack. So you have difficulty focusing. Other things that we don't even really think about, substance use. This is huge for lack of focus. Because if you're drinking or using pot on a regular basis, like that's going to impair your focus. That's what it does. Even things like caffeine dependence can alter your focus. Oh yeah, you don't have ADHD at 5 p.m. You're crashing from a combination of a circadian rhythm disorder with pounding too much caffeine in order to stay awake. Right? And then we'll even have things like narcolepsy, which people don't, usually people know when they're narcoleptic. And then there are other things as well. Like what are other factors that are even non-diagnostic or not even illnesses that you can diagnose that may impact your focus? So things like technology usage. So we know that, for example, consuming large amounts of short form content and highly dopaminergic content negatively impairs your attention span. So like as you watch more and more clips of stuff, your brain gets used to holding its attention on one thing for 30 to 90 seconds. And so then what's happening is like people are learning, okay, so like since the attention span is shortening, what we're going to have to do is make things more dopaminergic. We're going to have to make them more clickbaity. And so the more dopaminergic we keep it, like if something's super intense, happens at the 60-second mark of a video, then someone will stay. But if we bore them a little bit, they're going to click on something else. And so these kinds of things could be shaping our focus as well. So now this is something that when I see most people diagnosing themselves on the internet, they don't go through this process of differential diagnosis. And this is where I think most people make their mistakes. And this is what doctors are trained to do. So when someone comes in, like the whole point of being a psychiatrist is when someone comes in and they say, hey, I think I may have ADHD, I'm having difficulty focusing, I'm not going to jump straight to this. The whole point of my training is that I've been trained as a medical doctor, so I'm going to think about sleep disorders. I'm going to think about substance use. I'm going to think about other psychiatric diagnoses. I'm going to think about vitamin deficiencies. And then I'm also going to think about other stuff, like autoimmune disorders, like hypothyroidism, like lupus, right? So when someone comes in with ADHD, I'll ask them, hey, you have any rashes? They're like, what? No. I'm like, okay, cool. Probably not lupus. And so this is really what being a good clinician is about. It's about doing a good differential diagnosis. Because as we illustrated here, you can check the boxes very easily. This is what I think is the major shortcoming of self-diagnosis on the internet, is that you're not accounting for all the other stuff that it could be. Now, why do we see so much self-diagnosis, and is self-diagnosis necessarily bad? Now, this is where it's going to sound kind of weird, right? Because I just spent so much time telling y'all, oh, like this is why you can't diagnose yourself on the internet. So why does this happen so much? I think that this is where I'm talking about the value that doctors bring to the table, but I think it's also fair to talk about our shortcomings as doctors. So one of the biggest mistakes that we make as doctors is that we're arrogant, right? Because we do know all that kind of stuff. So what happens is sometimes we'll have patients who come in and they'll say, hey, I think I have cancer. And I, the doctor, will ask them a handful of questions, and I'll determine. Sometimes what will happen is I'll go through a process called premature closure, where instead of considering a good differential, I'll jump to conclusions, and doctors fall into that as well. And then what ends up happening is a lot of times patients don't get listened to. And doctors will actually make diagnoses and jump to conclusions and not actually listen to or perform appropriate diagnostic workups. Or in some cases, what they'll do is actually appropriate diagnostic workups that won't detect the condition. So it's not that the patient is wrong or the doctor is wrong. We're both happen to be right. It's just the patient could be in the exception, right? So not all diagnoses appear the same way. At the top of the list, a great example of this is endometriosis. So endometriosis is something that's actually quite common. So what endometriosis means is that there's endometrial tissue outside of the uterus. So generally speaking, women will go through a menstrual cycle where their uterine lining grows, and then as they get on their period starts, as menstruation starts, that tissue necroses, so it dies off, and then they slough it off, right? So this is what happens when you have your period. Now the challenge is that sometimes endometrial tissue can be outside of the uterus. And the thing is, we're supposed to slough off our uterine linings during menstruation, and that's designed. The body is designed for that. The challenge is that if you have endometrial tissue outside of the uterus, it's not supposed to be there. And so when you go through this necrotic process, it's incredibly painful. The challenge, though, is that oftentimes doctors will be very dismissive of this pain. So this is the real challenge, is that, should you diagnose yourself? I don't think so. But I also think it's very, very important that if you do go see a doctor and you do believe something and you have instincts about what's wrong with you, that you try to make that as clear as possible. And if the doctor's diagnosis of you feels premature, incomplete, or doesn't really account for what's going on, you don't have a good explanation that ties up what you're experiencing with what they're suggesting, then I think that's really worthy of further discussion. And this is where, frankly, a lot of my colleagues, and I myself have made this mistake as well, will be kind of arrogant about it, right? We start to think we know better than the patient. We may know more than the patient about diagnoses, but it's still really, really important, because as a doctor, what's your best source of information? Your best source of information is actually the patient. And what I tend to see that's kind of disturbing is that a lot of doctors are not paying attention to patients. And so that's where I sort of get that, I think you should do your research. I think you should develop hypotheses and then go in and talk to a medical professional about it. But be a little bit careful, because unless you're trained in differential diagnosis, the challenge of self-diagnosing on the internet is that there could be 1,000 other things that create this constellation of symptoms. And if you really want to make an accurate diagnosis, a part of that is ruling out all of that other stuff. So can you diagnose yourself on the internet? Generally speaking, I wouldn't recommend it. But I do think it's a good idea to educate yourself, formulate hypotheses, and try to share those as transparently as possible with a particular medical provider. And hopefully they'll incorporate your information into their diagnostic experience, and that's usually when you arrive at the best diagnosis. Questions? You've seen arrogant and unconfident doctors. It's tough. Yeah, absolutely. So Seiko 5 is saying yes, but doctors don't necessarily care about feelings. I would say the good ones do. So Rogue Weirwolf is saying, would it be reasonable to refer to old medical files about yourself? For what? For self-diagnosis? It can be. But I think especially when we're talking about psychiatric diagnoses have a way of piling up. Right? So what happens is, like, it's very hard for someone to remove a diagnosis from your chart. Like, that takes a lot of work. It's really easy to give someone a new diagnosis. So that's where I think you've got to be very careful about some diagnoses, because just because it's in your chart doesn't necessarily mean it's correct, especially for mental health stuff. Can becoming a parent bring on symptoms? Sure. So the most, I want to say, not most common, that's not correct, but a very common first episode of mania for bipolar disorder is post-pregnancy. So we'll see oftentimes in the postpartum period that, like, people who are bipolar will, like, discover they are bipolar. And then what happens is the stress of pregnancy and delivery, like, triggers a full-blown mania. And then as you talk to them and hopefully treat them, what you discover is that there were a lot of warning signs, like a lot of yellow flags in their history that show sort of like a cyclic mood, but that never sort of like that they were able to cope with, or like didn't really impair their function quite as much, or they just kind of like wrote it out. Where, like, so you sort of see that it was always there, and then the first episode of mania is postpartum. What if my family doctor doesn't listen to what I say? Do I just get a different doctor? I would start by talking to the doctor. Right? So if you all have a problem with your doctor, I think the first step is always just talk to your doctor, because they're supposed to be on your side, and sort of say, like, hey, I'm feeling like you're not really listening to what I'm saying. Just talk to him about it. Can I diagnose my doctor? Probably not. Do you feel like many Gen Zers are carelessly self-diagnosing themselves? What I think is careless about this generation is there's a balance between destigmatizing and, like, overgeneralizing. So for a long time, there still is a stigma against mental illness. So what we did is we took all the people at psychiatric diagnoses, we bundled them up, and we pushed them off to one corner of society. And we discovered, hey, that's really harmful, right? So, like, unlike cancer, where it's like, oh, you've got cancer, let's everyone support this person, because cancer is hard to deal with. So when cancer happened, we took people who were in the corner and we brought them in, and we're like, hey, we're going to take care of you. If someone has, like, an accident, right, where they, like, are handicapped afterward, let's say they, like, lose a leg, everyone, like, comes around and we support that person through their illness. But if you have depression or schizophrenia, if you've got major depressive disorder or schizophrenia, like, then don't tell anyone. So that was harmful. Then what happened is, now that we have social media and stuff, and we're in the process of destigmatizing mental illness, we're showing how common mental illness can be. The challenge is that sometimes we cross a line into like really generalizing into like normal features and calling it an illness. So I'll see all kinds of things that I think are essentially within the realm of normal behavior, like difficulty with focus, that people will automatically jump to ADHD or automatically jump to autism or autism spectrum disorder, right? Where they'll be like, oh, like this is a feature of autism. Like I have trouble studying for organic chemistry. This is what it's like to have ADHD. Can't study for organic chemistry. It's like organic chemistry is hard to study for whether you have ADHD or not. So sometimes I think what we're ending up doing is pathologizing normal behavior. Okay. Why is it always chemistry with you? Maybe because, so I actually liked biochemistry, less so organic chemistry, but I'm a big fan of chemistry. I feel like chemistry is something that, do more people take chemistry than physics? Walter White. Yeah, I think Kate Spade is saying physics was agony. I think it just depends on your teachers, right? Pathologizing is a type of overgeneralizing, sort of. So I would say what they do is they take like a normal feature of being human and then they call it a feature of an illness. So difficulty with focus is like a normal feature of being human. Right? ADHD is not just difficulty focusing. It's inattention that is so severe that you cannot function, or it's very difficult to function in like normal society. It's impairing. All right, y'all want to talk about confidence? We can talk about confidence. I see that someone missed the stream. Y'all can check out the VOD for sure. Yeah, I mean, I'm confident we can talk about confidence. Too good. Okay, we did fear of rejection and acceptance, right? That was the next one. Chat lords. Isn't that what we decided? Yeah, fear of acceptance. Okay, this is a good one. Ooh. Okay, chat. This is gonna be tough, but let's do it. All right, chat. Okay. Realized I don't fear rejection. I fear being accepted. Hold on. Let me do this. Let's start over, sorry. Okay. Realized I don't fear rejection. I fear being accepted, and that is what might be holding me back. Hear me out. I, 22M, just got to a point where I could easily ask a girl out, and the odds of her accepting are pretty high. However, I'm scared of doing it. Not because I fear the rejection. In fact, being rejected would be painful but at least it would be comfortable. I actually fear the unknown, and that there is after being accepted, especially when it comes to what my family and even other people would think of me going on a date. Yeah, I don't know exactly why, but I feel ashamed if my family knew. Dating is very, very daunting and I fear it, even though I want it so much. I feel like I discovered a gold mine inside my mind that I'd never explored. Maybe I was trying to fix the wrong problem. I think it clicked now. Just posting here because I had the realization maybe someone else feels this way. Awesome. So thank you for posting. And that's what we try to do here, is help things click in people's mind. So today we're going to talk a little bit about how on the surface we sometimes fear rejection. But actually what can be more daunting than rejection is actually acceptance. And the key thing about this is that a lot of times we'll self-sabotage. And we're kind of really frustrated with ourselves, right? Because we recognize that we're like sabotaging particular situations, but people don't really know like how to stop. And one of the key features of self-sabotage, in my experience, has been a fear of acceptance. And that may sound really weird because like, why on earth would you fear being accepted? Isn't acceptance what you want and what you crave? Isn't that like what we all talk about? Like, oh my God, like I want unconditional acceptance. Like I want people to accept me as I am instead of needing to change who I am to fit other people's whatever, right? That's how we think about it. But as it turns out, for a lot of reasons that we'll go into, first of all, sometimes we actually seek rejection instead of acceptance. Sometimes it's the fear of acceptance that actually paralyzes us as opposed to the fear of rejection. And that puts us kind of in a bind because if we want acceptance, but we're afraid of it, then we feel really, really stuck. So a lot of what this can kind of manifest as is a combination of it can look like sabotage, it can look like self-sabotage, it can look like feeling stuck and kind of wanting something, but being unable to actually reach for it. And then that results in self-judgment. So what's going on here? Where does this stuff come from? And how on earth does a human being become comfortable with rejection? So we have to understand a couple of things about evolution, the human brain, and kind of how we work. The first is that we, generally speaking, are going to be survival-oriented, not happiness-oriented. So I recently saw that there was a major hurricane that hit the southeast portion of the United States. And I saw videos of animals huddling in particular places that appeared safe in the moment, right? So let's say there's a hurricane, there's a group of birds that are like hiding in a building. And so if you think about like what it's like to be that bird, even though being stuck in the building is terrible, the bird doesn't say, like, look around and say, hey, like this building sucks. Like, let me risk going out into the hurricane and like finding a safer or better place. Once we sort of are in a safe place that we know we can survive, it becomes really, really difficult to go out and explore for other things. This is a bias that evolution has given us, right? If you have something that's not ideal, but you're relatively safe and you can survive in that situation, then don't go looking for other things. This is across the whole animal kingdom. That across the whole animal kingdom, we will prefer a, grubby survival, a difficult survival over the risk of like prosperity and happiness and goodness. But if we know we can survive here, we're not going to risk going out and winding up in a worse situation. So let's think about that for a second as well. So what I found from people who are comfortable with rejection but fear acceptance is that early on, they tended to be rejected a lot. So I'm going to try to illustrate this a little bit with the iPad, okay? So let's just take a quick look. So let's try to understand what it's like for someone who gets rejected a lot. Okay? So early on in life, here I am. And then I try something, and then I get rejected. R1. Okay, so that kind of sucks. And then I go out and I try something again. R2. I go out and I try something again. Oh, that turned into a B, but it's really an R. R3. And so what do you think my brain believes about the future ventures? What can I expect? So it believes fundamentally that the world is a dangerous place where rejection is likely. And since oftentimes people who are afraid of acceptance grow up in very like rejecting households, they sort of learn how to survive these three scenarios, right? So this is what happened. I can survive this, but I don't know. So if like over here, there's going to be more and more rejections, eventually I'm going to hit a rejection that is so damaging that I won't be able to survive it. Right? Because now, like, what reason do I have to believe that the world is like a kind and welcoming place? Actually, I have a lot of evidence to suggest that it isn't. So our brain is designed to develop patterns that predict behavior. That's what makes us human. Right? So we start making predictions about the world. So when I start to form these kinds of rejections, what ends up happening is I have core beliefs that start to form. I'm not worth it. People are untrustworthy. The world is a dangerous place. Okay? We start to believe these things. And you may wonder, like, why do we start to believe these things? Like, what is the value of believing these things? And this is really important to understand. All of these thoughts are actually protective. So I'll give you all just an example, okay? So if I'm interested in making a friend, but I believe that I'm fundamentally broken, and then the friend, let's say, rejects me, if I'm broken, then that sort of makes sense. And I can sort of tolerate that rejection easier. This is really important to understand. Because if I don't deserve friendship in the first place, like everything sort of makes sense. I have a reason. I have an excuse, right? I'm fundamentally broken. So it helps me cope with rejection, to just believe that I don't deserve it. Because it's way harder to believe you deserve something. Okay, so like, let me put it to you this way. So remember that happiness and suffering is the difference between our expectations and our reality, right? If I threw a birthday party and invited 20 of my best friends and prepped everything, we were going to have barbecue and nachos and cake, and I rented out like an awesome like space for us to have fun in. It's going to be so much fun. And then 0 people show up. This gap is my suffering. So if you look at, for example, like yogis and Buddhism, they'll sort of say that reducing your expectations is the fastest way to get rid of suffering, right? So it's if you just don't expect much, like you're not going to be disappointed. Like I heard amazing things about this movie Morbius, and then I went to watch Morbius, and it was not the most amazing thing in the world. So if we think about if I'm broken, what does that do for me? If I deserve 0 people and 0 people show up, there's less suffering, right? Because I just don't expect it of myself. Like I just don't, I don't deserve to be happy. So then when people reject me, like it's okay. So it's kind of bizarre, but these sort of these kind of like rejection, these core beliefs, and like believing that you're broken and believing that you don't deserve to be happy and believing that you deserve to be rejected actually protects you from the hurt. Because then when someone rejects you, it's like, oh, like I knew that was going to happen. Like, what did I expect? Of course this is going to happen. Right? So now we get to a really tricky situation. Because if I believe that I'm broken and I don't deserve happiness, and rejection is my baseline, and I've learned to accept rejection because it helps me be numb and it helps reduce that suffering, lowers my expectations, everything is as it is supposed to be. At least the world makes sense. So now acceptance becomes very dangerous. So sometimes what we'll discover is if someone has low self-esteem, and they start to get accepted, now things become very, very dangerous because like I'm supposed to be broken People aren't supposed to like me. So as I start to become accepted, it becomes confusing. It's suddenly like, back when I was a kid, I determined I'm not worth it. I learned this just as deeply as I learned gravity. And now if people start accepting me later in life, it's almost like gravity gets turned on its head, and like what was up is down and down is up. And it gets very, very confusing. And then since, remember, I believe that fundamentally the world is an unsafe place, if I don't know the rules of the game, and like I don't know how to play this game, and the world is fundamentally dangerous, now I've entered into unexplored, fundamentally unsafe territory. Oh, sun's safe. And this terrifies me. Because I don't know how to play this game. I can play this game. I know the rules here. Not only do you know the rules of rejection, you can even control the amount of rejection, right? If you're someone who's really, really has low self-esteem, you know exactly what I'm talking about, where you can titrate the rejection. They're going to reject you, but like you can titrate it, right? You can have them reject you more, or you can have them reject you less. You know how to mitigate that rejection to make it feel safer. So then what happens is now we're in unexplored territory. It's fundamentally unsafe. So what do? When you're out in choppy waters and you don't know where you're going or what's going on? You sabotage. And you invoke rejection. Right? You sabotage it. You say, okay, this area feels unsafe, but this area, I know exactly how this works. This feels way safer. I can control it. I can handle it. I can survive it. But what's actually even more devastating is the idea of like then believing that you're no longer broken. Because as we get accepted, we start to believe I'm not broken. And the thing is, this is the most dangerous and painful belief of all. Because what hurts the most? Being broken? Like the act of breaking? Or then having all the shattered pieces just on the countertop? It's the act of breaking that is actually the most painful. And you learned that, right? Because this first rejection hurt so much, and then you were broken again and you were broken again. The act of breaking is the most painful part. And if I'm broken, I can't be broken anymore. But if I dare to believe, if I start to become accepted, if I start to feel whole, then I can be broken again. And this is absolutely terrifying. Because now, like, I have to put down the armor. I have to be vulnerable. I have to open myself to breaking all over again. And there's another layer of this that's actually incredibly sad. Is that if you're going through life, if I'm broken, rejection number 1 makes sense. It's just in some way. R2 is just in some way. R3, oh, why do I do B? Is just, right? It makes sense because I'm broken. Of course these people would reject me. But if I'm not broken, then how do I understand this? Why did these people reject me? It actually hurts way more, right? To get very little in life and deserve very little in life hurts less than to deserve a lot and get a little. So sometimes the most terrifying thing for people who feel broken is to actually be accepted, recognize your whole, and then reinterpret your entire history. And then realize like how devastatingly you were treated. You may think it's liberating, but it's actually so painful. Because if I'm broken and I'm unlovable and mom or dad didn't love me, like, I can handle that. But if I deserved love and they should have loved me, but they didn't anyway, that actually hurts so much more. Because it's not the way that it was supposed to be, but it happened to you anyway. Because when we start to believe that we deserve it, we take control over it, right? We're not hapless victims if we're broken. And then there's another layer on top of that, if you guys want to even go deeper, which is that if I didn't deserve to be rejected, then holy crap, I could have gone through life without being so rejected. Holy crap. If I wasn't rejected, if this turned into an acceptance, and this turned into an acceptance, and this turned into an acceptance, I would be a completely different person. And then what you have to do is grieve the gap between this person and this person. Oh my God, if I was treated the way that I should have been, my life would be so different. And the gap and grieving this gap can be absolutely devastating. The realization that I was supposed to actually be happy in life and I wasn't is actually harder to deal with than I don't deserve happiness and I am unhappy. So I really applaud this person for kind of like making these discoveries about, confidence and realizing that what you really fear is acceptance as opposed to rejection. The tricky thing is that this is really common. And even though we all strive for acceptance, we want to be accepted. At the end of the day, that I think is our most natural and healthy state. We have to recognize that if we've grown up being rejected, that acceptance is actually really, really terrifying. And unless we're aware of it, what we'll end up actually doing is sabotaging ourselves. Because anytime we move towards acceptance, and sometimes you guys may have even seen this, like you may have dated someone who has a history of trauma, and the second that things start to like move in a healthy, like welcoming direction, they will sabotage it. Right? Like and they kind of drive you crazy with their sabotage because you're like, no, I love you. I want to stay in this relationship. I care about you. And they're like, no, you don't. You deserve better. And then what happens is like anytime some neutral thing happens, like your phone runs out of battery and you don't respond to text messages, they're like, ha, I knew it. You don't want to be with me. Right? And then it all starts again. And then you're getting frustrated because you're like, no, like I'm trying to explain to you, like I want to be with you, but my phone died. It has nothing to do with me rejecting you as a human being. It's just life. Like there are ups and downs in relationships, but they don't see it that way. And this is kind of what's going on in them, potentially. So it can be really challenging. We sort of all want acceptance, and yet we can be very terrified of it. And so if you're in that kind of situation, you need to think a lot about, first of all, what do I believe about myself? Where did I learn to believe that about myself? As people start accepting me and being nice to me, let's pay attention to how I'm responding and do so non-judgmentally, because if you say I shouldn't be responding this way, that's going to make things harder. Just notice what your reaction is. And then what you'll notice is that out of that reaction are going to come particular behaviors. Like, now that this person is starting to really accept me, let me trauma dump on them to push them away. Let me do something that tests the boundaries of the relationship. Because I'm not quite sure. I think this person is BSing me. So let me sabotage a little bit. And if they really care about me, then they'll stay, despite the fact that I show them how broken I am. And then you start testing them in relationship and you start playing games. And suddenly they're being scored. They're competing in the Olympics, but they don't realize it. And there you are, like a panel of judges with all these different scorecards. And they're playing a game and being measured in a way that like they never consented to. And neither of y'all are truly even consciously aware that you're doing it. And then you'll end up sabotaging. And as you sabotage, you invoke the rejection. As you invoke the rejection, everything you believed about the world becomes true again. Ha, I knew it. People who accept me cannot be trusted. They will only reject me eventually. It is just as I understood. I am broken and unlovable. But that is a game I know how to play. That is a game that I've leveled up my entire life. That is a game in which, even though it hurts, I know I can survive. I may be shattered, but I'm already shattered. You can only shatter me so much. What I can't stand is being put back together and shattered again. Believing that I could be whole, believing that I could be loved. And so everyone's like, I'm afraid of getting rejected. I'm afraid of getting rejected, which makes sense, right? It's a valid fear. But what we sometimes miss sight of is that it's not actually a fear of rejection. It's actually a fear of acceptance. Questions? Yeah, Lost in Space 9 is saying that hits hard. You're damn right it does. See, here's the thing that we need to understand. We think of good emotions and bad emotions, right? We say joy and curiosity. These are good emotions. And anger and fear and resentment, these are bad emotions. But there aren't good emotions or bad emotions. There's certainly emotions that bring pleasure and emotions that bring pain. But all emotions have their purpose. And even some of these negative emotions like low self-esteem or shame or other kinds of things can, oddly enough, be protective. Otherwise, we wouldn't have evolved to have them. It's a conserved experience across all human beings to have all of these emotions. And so if you're stuck trying to figure out what's wrong with my relationships, I have a fear of rejection, tunnel down a little bit further. Do you truly fear rejection or do you fear acceptance? And you may say but of course I feel rejection. I want to be accepted. So this is the wild thing. You can want something and be afraid of it. The two are not mutually exclusive. In fact, they often go hand in hand. It's I want to be a parent, but I'm terrified of being a parent. Makes perfect sense. I want to be married, but I'm terrified of being married. Another one that I've seen a lot. I want to be CEO, but I am terrified of all of the responsibility. I want to run the company. I want to lead the company. But oh my God, what if I screw it up? Because if I make a mistake, there's no one looking out for me. So what we want and what we're afraid of oftentimes go hand in hand. Now everyone is saying, what do? First thing is to notice. Right? See, because here's the thing. You can't fix something unless you understand what it is. Does that make sense? Can't fix it unless you know. So the reason that people can't fix this thing is because they think it is a fear of rejection when it's actually a fear of acceptance. They're like, oh, I'm afraid of rejection because anytime I'm about to be accepted, I subconsciously cause the other person to reject me. And then that hurts, but it's a hurt that I can handle, which is why I induce it in the first place. And then oh my God, I keep on screwing up, sabotaging my relationship. So first understand, ask yourself, am I afraid of actually being accepted? And if you're wondering, how do I ask myself if I'm afraid of being accepted? Just as things happen in relationships, pay attention to your internal environment. How am I reacting to this? Why am I feeling this way? What's going on here? And then ask yourself, how would I feel if this person loved me unconditionally? I'd feel amazing. Sure. But what about the steps along the way? Before you get to unconditional love, you climb 1,000 little steps of small amounts of acceptance or love. And how do you react to those? Because what probably happens is you want to get to unconditional love where there are guarantees, right? That's what unconditional love is. I want guarantees that this person will never reject me. But as you build up to that, they can still reject you before that, right? They can reject you 1 step below, 2 steps below, 3 steps below. You're still open to rejection. And then what you begin to realize is the closer you get to unconditional love, if you get rejected right before you hit the finish line, then that's going to hurt a hell of a lot. And if you believe you're fundamentally going to be rejected before you get to the top before you get to the finish line, then each step forward becomes something to avoid. Right? It's why like silver medalists are the least happy. Gold medalist, very happy. Bronze medalist, got it. Got one. But to fall just short of the gold can be the hardest thing. And so what we end up doing, I'd rather not race. It's gold or nothing. Right? So, silver is really good. Don't get me wrong. I think it's wonderful. Crumbled Abs is saying, I failed mortgage license test by 1.5 years ago and never tried again. Yeah. How do you feel about that? This is repetition compulsion in psychoanalysis? Absolutely. So I don't know if it is, but everything I'm sharing with y'all is influenced by repetition compulsion from psychoanalysis. Agreed. And this is the thing. If y'all are kind of stuck in this cycle, so I do think that you could go see a psychoanalyst. I think this is the kind of thing where you've got to really think about, okay, like, what do I want? Do I want to be healed? Then I would say, go see a therapist. If this kind of thing is getting in the way of particular things that you're trying to do, and your goal is to really do those things, or maybe another way to put it is, if you are trying to do those things, but you don't know what's getting in the way, then I think coaching is a good fit. Right? So this is where like coaches are pretty good at helping people discover this kind of stuff about like, okay, what am I actually afraid of here? And what's actually getting in the way of me like accomplishing and becoming the person that I want to be. So Tropics22 is saying, I'm afraid of acceptance in one type of relationship, but in another I'm not because I didn't get rejected in the other. Perfectly said. Right? Because fearing rejection is something that we learn. A child, an infant, is not the default state of an infant is to not be rejected. Rejected is something that has to happen to the infant. Right? So like generally speaking, with healthy enough parenting, like we develop a secure attachment style and we're not, like, the world is a safe place that is okay to explore. Real question, who do you go to for an official diagnosis for ADHD? You can go to any mental health professional for a diagnosis of ADHD. ADHD is a clinical diagnosis. You do not need testing. Oftentimes, people will administer testing just to kind of make sure, but you don't need testing. You can just go talk to a clinician who can diagnose you with it. Ristatero is saying, world is a safe place? Yeah, actually, it's pretty safe. If you have a complex psych history, a test might be good, right? Yeah, absolutely. That's a good reason to do a test. So tests are used when we don't know the answer without a test. That's why we do tests, right? Oh, I've got a sore throat, a fever, and my nose is sniffling. Do I have COVID? Well, I don't know. I don't have enough information to know, is this the flu or is this COVID? So what do? I get a test. Make sense? I did not see the Ask Reddit thread about asking to protect our sons from becoming incels. I didn't see that. Elder Hero 1 is asking, how can you help a friend or partner who fears acceptance and tries to sabotage the relationship? I think having a conversation with them about it. right? So helping them gain awareness of what's going on. That doesn't mean that you're going to go in there and you say, hey, you're sabotaging the relationship because you truly fear acceptance. Like, I wouldn't go in leading with that. What I would do is, hey, like, we were supposed to hang out on Friday and you didn't show up. What happened? Because what's going to happen is there's going to be a behavior that will strain the relationship. And what you've got to do as best as you can is non-judgmentally explore that behavior with them. Okay. So we are... I got to go soon. So let's meditate. What do y'all think? Meditation. We haven't done meditation in a long time, so let's definitely meditate today. What kind of meditation do y'all want? Acceptance. Dismantle ego and shunya. Okay. Give me a second. Let me think. Okay. We can do shunya meditation. All right. So let me turn that off. Okay. So what we're going to do is let's start by sitting up straight. So I'm going to teach y'all a shunya-oriented technique today that is... How can I say this? It is, I think, the first step on a very long journey to a particular siddhi that Patanjali talks about. Okay? So this is going to be a shunya-oriented meditation that is geared towards space, for lack of a better term. So what we're going to do is sit up straight. So remember, for any meditation technique, we want spine straight, neck straight, head straight. Okay? So close your eyes. Now, if you have something like ADHD, you may find that half-lidded gaze is actually easier. So like kind of like a low kind of gaze that actually makes it easier for you to concentrate. So half-opened eyes. I definitely don't recommend that if you're working near a screen. So sometimes the half-lidded gaze can work, especially if you're in a natural environment, like a peaceful place where you can open your eyes and it kind of looks good or is not too distracting. So I'd recommend eyes closed. And we're just going to start and notice our breathing. I want you to feel the weight and positioning of your body. Notice how your body is interacting with your environment. You may be sitting in a chair that's holding your body up. The chair may have a backrest that's pushing against you. And now turn your attention towards the room that you're in with eyes closed. And notice that there's somewhat of an image, a shadow, an afterthought of the room. That technically in this moment, you have no sensory input of the room. That the room just exists as a memory of your sensations. That you remember seeing the walls of the room. You remember the corners, the windows, the tables, the furniture. But that if this was all your consciousness was, if this was your only experience of life, if you existed for just an instant, and that instant was now, you would have no idea that there was a room. Then go to the things beyond the room. Places that maybe you were, maybe your home, the apartment building, even potentially a car or a bus or where you work or a friend's house. All of what you've constructed in the world around you. In this moment ceases to exist. And even your relationships, the people in your life. If this was all you experienced of life, those people too will fade into the background. They exist in this moment only as memories. Sensory impressions of times past. As you breathe in, notice the frontier of your awareness. What you actually know exists. What you can experience in this moment. The border of your body. And now even notice that the chair that you're sitting on, the backrest, those two is not a chair. All it truly is a sensation of pressure. It is a signal sent to you by your body. Even the chair ceases to exist. What truly exists is the pressure. And as you notice the frontier of your experience, some of you may notice that it even extends a little bit beyond the physical border of your body. As the chair melts away and all that exists is you, notice the blackness in every direction. The absence of walls, the absence of buildings. Don't think about the building, but you can't feel it. So any direction that your attention goes, it returns with nothingness. However far out you go, in whichever direction you go, nothingness. Feel yourself floating in a great big void. In the inky blackness of a completely empty universe. The nothingness extends out in all directions. And there you are, floating, untethered. Notice there's nothing to fear. Your mind may instinctively react with fear. You don't need the world to exist. Because you do. And drift. And now begin to come back. Notice that the spell can be shattered with movement. We're not going to open our eyes yet. But as you move your body, notice yourself returning to the world. Put your hands together in front of you in Namaste position. Bow your head slightly. Give thanks for being able to exist in this moment and in this time. When you're ready, open your eyes. Okay, so we're seeing a lot of different things. One is some people are saying, didn't work for me. It's okay, it's not for everyone. Other people are saying, I had to stop, too anxious. Me too. But I didn't stop. So that's where, if you became anxious during this technique, you don't want to bully yourself into it. But why are you anxious? Because you're untethered. Everything that we rely on to determine who we are exists out there. My family ceases to exist. Who am I? It's untethering, very anxiety provoking, but float. Let the ocean, that inky black ocean, just carry you. Nothing will happen. You just exist. It's absolutely terrifying. And yet, what's scary about it? You're just sitting there. You can feel your breathing. You exist. What's wrong with it? Nothing. It's a moment of perfect inky black peace. The only thing that's anxiety provoking about it is the loss of the outside world. If you existed for just a moment in time, if you just existed, if your entire consciousness and your entire existence was 60 seconds of that practice, there's nothing to fear. that is just floating. And as you spend more time in that place, that's when you will begin to realize this is what is real. And everything that you let go from out there will lead you to shunya. Not for the faint of heart. Blazing Sunshine is saying, my dad passed away this year from cancer. I felt I was with him and it was terrifying. I warned y'all. I told y'all this is the first step on a practice that will lead to siddhi. So not uncommon to have experiences like that. Right? It's terrifying to connect with what is and stop living in a world of illusion. Right? People are sort of saying it kind of reminds me of psychedelics, to be honest. Yeah. So remember that any substance we put in our body activates receptors. It doesn't usually create them. I mean, sometimes you can see, receptor transcription and stuff like that over time, but it just activates what is. Sometimes it hyperactivates it. Sometimes it activates in a very unnatural way, but the machinery, the hardware is there. Do y'all get that? So Cade Spade is saying, reminds me of ketamine treatment for depression. Yeah, shunya meditation is going to be like that. Right? So ketamine is going to have a dissociative aspect to it. And this practice is almost like in that vein. Right? So what's real? We're not saying that you should ignore all the worldly influences. This is really common where people are like, oh, like nothing is real, so fuck everybody else. No. Be a good human being in the world. But try to figure out for a second what truly exists. Right? So don't, when you've taken the first day of class, you don't build your entire life based on that first day of class, right? You wait till the end of the course to try to figure out, okay, what are all these concepts? What do they truly mean? And then you start making a change. Okay. Good. Who are you rating today, my friends? Present moment exists, right? Right? You tell me. My love. Yeah, I was going to say my love. I did not finish that, though. Yeah, so this is where a lot of y'all are coming up with good logical things, right? Asriel was saying, but just because I don't see it doesn't mean it doesn't exist. Good point. Someone else was saying all moments exist. So this is the thing. If you guys want to be happy in life, you have to understand the fundamental nature of existence. And if people say, well, like, that sounds ambitious, it's not that hard. Just start with yourself and see what exists. What is a manifestation of mind and what is a manifestation of experience and consciousness? Thanks, Riot, for sort of helping someone know that there's meditations in the guide. Okay, but who are you rating for real? I'm just seeing lots of debate raids. Is your mom a real person? Let's see. Nope. S-Fand? We can raid S. S-Fand is playing WoW. Do y'all want to do WoW Raider? Or Simply? Didn't we raid Grubby already? Grubby? We can raid Grubby if y'all want. But I thought we raided Dota people too much. Hannah? Hannah just chatting? Okay, people are saying S-Fan, so we're gonna raid the Chad God S-Fan. Okay? By the way, if you guys want to know body image stuff, just look at Chad pictures. That's a great example, by the way. So let's go S-Fan. Alrighty, let's go, chat. Go, go, go!